Hundreds of nurses who called in sick yesterday returned to work today. Good evening, everyone. I'm Keishla Adderley, and welcome to the Bahamas Tonight, the National Report. Topping news tonight, public health care services were back to normal today as nurses returned to work after a sick out on Monday, which negatively impacted services. Vern Carey tells us that health officials are now looking at ways to address the chronic issues plaguing some 1,500 nurses in the public health care system.
After staging a mass sick-out across the country Monday, nurses in the public health care system have returned to work. This according to Health Minister, the Honorable Dr. Dwayne Sands. The sick-out significantly impacted the delivery of public health care services, prompting the closure of government clinics and the cancellation of a number of surgeries at the Princess Margaret Hospital. Meanwhile, Dr. Sands said the issue of unions using sick-outs as a bargaining tool will have to be addressed moving forward.
We would have had a total of 5 people call in thus far, but that is probably not anything other than the usual. So it appears as if the nurses are no longer ill. Numbers of people can get sick, but it would be very peculiar for 200 people to get sick in the absence of some public health issue. And so when we look at these tools, as we evolve as a country, the question will have to be asked whether that loophole ought to be closed.
The health minister said the government is moving aggressively to address the chronic issues plaguing nurses in the healthcare system.
We would have seen to it that some $55,000 of outstanding mileage accrual for a group of nurses was placed on the pay sheet, and the expectation was that they should have had that money in their accounts last payday. If it was not on the pay sheet in April, I am advised that it will definitely be on the pay sheet in May.
Dr. Sands also noted that the confirmation of nurses and the proposed shift system are being addressed.
In terms of the confirmation of nurses, 3 years, 5 years, 10 years, we have moved aggressively to deal with these issues that have been outstanding for a decade. The matter of the 4-on, 4-off, the Public Hospital Authority had not implemented the change in shift system. And so to disadvantage the public on the basis of a conversation, to me is unfortunate.
Now, we reached out to President of the Nurses Union, Amancha Williams, for comment, but our calls were not returned up to news time. Vern Carey, ZNS Network News.